Welcome to the half hour to health. Blood pressure. Now, this is interesting. Are you ready to change your perception? Share this information with the local drug guys, okay, the people that are passing out medications. But let's first off look at this. Now, understand, is your body ever exposed to physical, chemical, or emotional stress?
Every day.
Yeah, all the time, all the time. This is normal. Without stress, you die. But what's interesting is your body's response to physical, chemical, or emotional stress is the exact same. So if you're chemically stressed out, your body responds like you're being chased by a tiger. If you're emotionally stressed out, your body responds like it's being chased by a tiger. If you're physically stressed, where you're actually injured, your body responds like you're being chased by a tiger. So now on this handout here, you're going to see on one side, it says sympathetic and parasympathetic activity. The best way to understand blood pressure is to get a little anatomy lesson. So this is going to be huge. We're going to explain a lot about the autonomic nervous system or automatic nervous system. And you're also going to understand the most confusing chart in the world in just a few moments. If you understand this, the quality of your life will be increased dramatically. But let's look at how a human body works. Now, first off, under physical, chemical, emotional stress, now let's say you're being chased by a tiger. What happens to your heart if you're being chased by a tiger? It elevates. Also, the liver breaks down glycogen to glucose, so blood sugar elevates. And this is under any type of physical, chemical, or emotional stress. Now, the blood supply to the intestines is going to be shut down. So this means under any type of stress, physical, chemical, or emotional stress, blood pressure is going to be elevated, blood sugar is going to be elevated, blood supply to the gut is going to be shut down. And this is this an abnormal response or a normal response? Completely normal, and it's designed to keep you alive. So this is a phenomenal system. Now, if, let's say you have physical, chemical, emotional stress, what do you think happens to blood pressure under that? It goes up. Now, if you look at this chart here, there's ways, any choice that you make, okay, any choice that you make is either going to take you a step towards death or a step towards health. Okay, does that make sense? So if you choose something like Diet Coke, you're taking a step towards death. You choose something like water, you're taking a step more closer towards health. Okay, does that make sense? Now let's say under response, under physical, chemical, or emotional stress, your blood sugar's elevated, your heart rate's elevated. Okay, those are normal responses. If you give a drug to change your body's physiology, does that make you healthier or sicker? Don't answer yet. Let's look at science, okay? So first off, adding drugs to the system, that's a chemical stressor. Now let's look at what people consider, let's just say textbook normal. Well, the normal blood pressure, the way blood pressure is measured is in two numbers. It's usually a bigger number over a little one. And let's just take, for the heck of it, 120 over 80. Although, bite your tongue if you're going to say this is normal, because it's not. Okay, this is not normal. I'm going to tell you what normal is. The first number, the big one, the 120, that's called systolic. Okay, now systolic, if you look at the heart, how blood pressure is measured, the first number is the overall output of the heart. So that's the output of the heart. Now, arteries have certain elasticity to them. So have you ever seen a boxer in the ring? How they run up to the ropes and they bounce off of the ropes and they can use that kinetic energy to propel them in the ring? Blood does the same thing. So since the arteries have that spring ability, systolic, the first number, uses that spring ability of the arteries to maintain it. The tough part is as you age or as you get more toxic exposures, arteries lose their flexibility, so the first number always goes up. So that's why I'm going to say, don't look at the first number as 120. Understand that's a variable. It varies on the flexibility of the arteries. Okay, so systolic is the heart output. Diastolic is the overall resting pressure of the body. So now if diastolic's hard, that means certain organs could be stressed. If the systolic is hard, it means the heart could be stressed. Now, if you look at the real sensitive organs of your body, there's two of them. You got kidneys. Now, they're blood filters, and they also help regulate blood pressure. But if you figure a kidney is about the size of your fist, and it filters 6 quarts of blood every 20 minutes. So the kidney has so many blood vessels. Anything that changes blood pressure can start to damage kidneys if kidneys are weak. And if you're curious, guess what medications negatively affect 2 organs, kidneys and liver? So we got to be cautious of that. So now if the systolic is really high, the heart works harder. If the diastolic is high, blood vessels are strained.
Did you answer that question?
What?
You said what 2 medicines?
What two organs are strained? Okay, under that, kidneys are one of them, brain is another.
No, I thought you said what kind of medicine.
Oh, all medications will negatively affect the kidneys because medications toxicify the blood. They slow or stop a metabolic process, but we'll show you that. But they're going to negatively affect either the kidneys or liver. Okay, and that's huge because if you're taking a drug and it negatively affects the kidneys, it's going to be not good for blood pressure. So now I got this off of WebMD, and if you want some really bad advice, WebMD is a good place to start. Okay, now they say high blood pressure is classified. Normal blood pressure is less than 120/80, which is curious because a few months ago that would be considered normal, but we just decided to change it randomly. Okay, pre-hypertension is 120/80, 139, then hypertension is greater than 140/90, stage 1 and stage 2. Okay, and then all patients, get this, all patients with blood pressure readings greater than 120/80 should be encouraged to make lifestyle modifications such as eating a healthier diet, quitting smoking, getting more exercise. Treatment of medication is recommended to lower blood pressure less than 140/90 for patients who have had diabetes or chronic kidney disease. The recommended blood pressure should be less than 130/80. Any science behind those recommendations? How did they get up with normal? How did they know what normal is? Okay, does this include everybody? It says all patients. So does this mean it doesn't matter if you're a teenager, okay, who eats fast food, or you're an 80-year-old person who has had 50 years of smoking history? All patients? Does that make sense, or does that sound illogical? It's completely illogical. Okay, we're going to find out that the science and research behind these recommendations is absolutely ridiculous. First off, now here's Dr. Paul Roche, president of the American Institute of Stress, clinical professor of medicine and psychiatry. High blood pressure is not a disease. Whoa, you mean it's just a clue to how the body functions? It is simply an elevated blood pressure reading on some measurement device that can have many different causes. And that helps to explain why we have over 100 drugs to treat blood pressure. Do you understand that if you have 1 pound of extra fat, you have an extra mile of blood vessels? Okay? So anyone that's overweight has to have higher blood pressure readings. Now remember, let's look at this. Let's say you're 20 pounds overweight. Is your body, with 20 more miles, does that heart have to work harder to get 20 more miles of blood pressure through the system? Yes or yes? So now if you force blood pressure lower to someone to whatever random reading they come up with, does that make the person healthier or sicker? Sicker. Why? Because it slows down the blood pressure, and that may be compromising it. But let's just look at the research behind it. Now, this is out of Harrison's medical textbook. It's about a 30-year-old textbook, but there's some common sense. See, this was before pharmaceutical industry has really taken over the medical schools. Now, listen to the common sense here. According to blood pressure, whatever form of therapy is selected, it must not be forgotten that the physician who treats hypertension is treating the patient as a whole. Oh my gosh, that makes so much common sense. Rather than a separate manifestation of a disease, the first principle of the therapy of hypertension is the knowledge of when to treat and when not to. Oh my gosh, does that make sense? So are they saying that not all people need to have this number, this number, this number? Okay, they're saying you got to know when to lower it, when not to.